and I'm from Smithville, Missouri, just outside Kansas City, my husband and I. And Relive came into our lives a little over 7.5 years ago. And at that time, I'd already been supplementing. I believed that was just something that was good to do. I took good quality supplements, not ever expecting to get results, just like I said, thought it was something that we needed to do. And when started on the product, I'd already been dealing with 25 to 30 years of daily sinus headaches, a lot of drainage, allergies and things. Found myself taking more and more over-the-counter medications to deal with those, and never took the headaches away. It ended up instead causing increasing issues with acid reflux for me that was starting to get worse, so I took stuff for that as well. I also was getting to the point that I was having sinus infections once and sometimes twice a year, and had to get an antibiotic for that also, and the doctor told me I needed to be on regular allergy medication, just basically for prevention. And so he put me on that, but I still continued to have those sinus infections. And when I started on the products, I first, within a few days, saw more energy and mental clarity that I didn't realize I was dealing with. I realized that by the end of that first week that acid reflux was starting to improve. I basically don't have much problem with that at all anymore. My sinus headaches are about 95% better, and I have not had one sinus infection at all, had to have antibiotic, anything, since I have been on Relive in over 7.5 years. And so I'm very grateful for that and other things, just even in my family prevention-wise. But my husband, we are involved in ministry, and he does a lot of traveling. When he started on the products, it was basically just for prevention. He wasn't dealing with anything as far as he knew. He ended up feeling like he had more energy, was doing more, lost about 20 to 25 pounds on the basic products without even trying. And he travels a lot, in and out of a lot of people's homes, doesn't pick up the colds and flus and things like he used to, and if he ever does start to get something, he gets over it very quickly. And part of his traveling is he actually travels overseas, most of the time to Africa, and that is where he has gotten his greatest results. After he'd been on the products for about 1.5 years, he got bit by a mosquito and got malaria, and he got very sick that night. They took him to the hospital, did all the conventional treatment that they normally would do, giving him fluids and things. He had his Relive with him, was taking his shakes, but couldn't take extra. He just had enough to take 2 shakes a day, but he was taking that, and we really feel that between that and a lot of prayers that people were praying for him, that his immune system was just so strong that he was able to bounce back in less than 24 hours, was on a bus, traveled several hours, and was on his feet several hours the next day, able to teach and train the pastors and do the ministry that he was sent there to do. And he's never had any problems, with malaria or anything since. And so we're very grateful for Relive for that as well. Our kids have had great results as well. Our youngest daughter with allergies as well, and our oldest son had a real bad car accident where he severely dislocated his ankle, and it helped very much in the healing process of that. Our oldest daughter had all 4 of her wisdom teeth taken out at the same time, and within 2 days she was eating regular food. She took the pain medication that they gave her, which did nothing for her, but as soon as she took her Relive shake, she was asleep within a matter of minutes, about 20 minutes, and she said, "It worked, Mom." And so she was very thankful for the products. And some of the children don't take the products safely, like many times we struggle with their kids doing, and they're all adults now. But our other child, our youngest son, he's the one who's always been the most faithful in the products, and he has been taking the products ever since he was 16 years old, and he's very athletic. He had great results with knee pain from sports injuries. But he also has done a lot of traveling and been doing mission work, and just he would stay healthy when others on his team did not because of Relive, he felt. And more than anything for him, which, we are most grateful for, because we feel that, if we had ever said no to Relive, or if we had quit and given up, we don't know what we would be doing, where we would be now today, because we had no idea 5 years after being on Relive what would happen in our life. This son, who is 16, is now 24, but 2 years ago he was doing mission work in India, had to be brought home suddenly in a medical emergency because he was acting very out of character, and they could not figure out what was wrong with him. He came home. They first thought it was schizophrenia. He was in and out of hospitals, 4 different hospitals in a matter of just a few weeks, and ended up even having to put him in a group home. For a while, we gave up our guardianship to the state, just because we were having such a difficult time dealing with him, and just wanted to be able to be the parent rather than be the authority figure, and that really helped a lot. But they ended up diagnosing him with bipolar, and he was taking his shakes faithfully, but when he would be having his episodes, he would not take the shakes, and then end up, he'd take less and less and start to take none at all. And we just finally came to the point that we decided for us that he needed to get stable with medication, and he was taking shakes as well. And then once he did get stable, he wanted to try and get off that medication, and we did too, because he was having horrible side effects. This was a fun-loving kid that brought so much joy into our home, was smiling and laughing all the time, had a huge passion for the Lord and sharing Christ with others, and like I said, very athletic and outgoing. And when he was on these medications, he lost all passion and desire for anything. The medication ended up causing him to gain 70 to 75 pounds, and he lost all joy for life. And just other things that we saw, his hand would be kind of shaky, and he'd hold it funny, and was just sleeping a lot. And so once the doctor started to wean him off, we saw improvements, and he was increasing his shakes, and he wanted to just take the Relive. And we told him, we gave him an ultimatum, that you have to be faithful on the Relive, or we're not going to do this with you. And he said that he would, and he has. And we just really praise the Lord that it has been over a year now. He's been completely off all medications. He's maintaining everything just with Relive and eating healthy again, and also exercising regularly. He goes to the Y all the time. In fact, he has pushed us to join the Y with him, and he's lost all that 70 to 75 pounds. We really have our son back. He is a full-time student again. He works about 30 hours a week at a convenience store that he works at here. And, like I said, we are just forever grateful, and we don't know what we would do without Relive. One other more recent result that Bill is aware of is that because he loves to do so much and keep active, and that he's done actually 2 triathlons now. After doing the first one, he didn't allow himself to recover enough and pushed himself too much and majorly ruptured a tendon right in the back of below his knee all the way down to his ankle, and was in extreme pain. And we just adjusted the products and added a little bit more, added a lot of the Lunarich X, and within 1 week, he told me that he had biked a mile, and within 2 weeks he had run 4 miles. And he's actually getting ready next Saturday. He is going to do a half marathon, and he has increased his times as well from what they were a year and 2 ago. And so he very much, I've asked him, if he thinks that Relive is what helped him with that, and he said most definitely. So
that's great. Thank you.
I don't know what our family would do without the product, so we're very grateful.
Pretty dramatic results, from malaria to ruptured tendon to bipolar to all the many other things that we've heard about. Thank you so much for being on the call and sharing.
You're welcome. Thank you.
Well, next we're heading over to New York. I have with us Michelle Feathers, and Michelle, we'd love you to share.
Hi, Bill. Thanks for having me.
Sure.
I am so excited about Relive. I started 21 years ago. It's hard to believe. And before Relive, I thought I was healthy. I took a lot of vitamins, trying to do the right thing, and my sister had invited me out to a presentation. And when I heard about the products, I just, it just hit me that this is complete and balanced. And, I was trying to cook right, eat right, do all those things, and my daughter was 5. And even though Mom is cooking right, that's no guarantee that your kids are going to eat right. And she didn't. She was very picky, and she had a lot of health issues herself. And so I thought, okay, let's try this. 2 shakes a day. I went on it. I put my daughter on it, and it was just for good nutrition. I wasn't looking for any changes because I was ready, on all those vitamins, and I didn't think I had any issues, even though I had a lot of doctors, and those doctors were taking care of my sinus infections. I had, from spring to fall, I was constantly on antibiotics, had a lot of environmental allergies, allergic to everything outside, and hormonal issues that affected 2 weeks every month with depression, anxiety, hot flashes, mood swings. It was to the extreme. They call that PMDD now. There's a fancy name for that. And so my life was really upside down, even though I thought I was healthy. It's kind of funny. But when I started taking the shakes, my whole system just balanced out. And within 1 month, I had no symptoms or anything of any kind of PMS. All the depression, everything was gone. It was just lifted. And so I just praise God for that. My life has been changed just with that in itself. Every 2 weeks I was dealing, with my life upside down. And so I've gained 2 weeks every month for that. No more sinus infections. That did take about 6 months, but I have not used antibiotics in a little over 20 years now, which is wonderful. And allergies, no more issues with that. Now, I also had, before Relive, I was diagnosed with cervical dysplasia, which is a borderline cancer. It's an early cancer in the cervix, and it's caused from the HPV virus. And so I had that, and the doctors, I had a cancer doctor, and he did a surgery where they burn out layers of the cervix. So they burn it out, but then those cells come back, and they're supposed to come back healthy. Well, mine did not do that. And so I had gone back in. They told me the situation, and that's when I had found Relive. And so they wanted me to do that second surgery, and he said, Michelle, every time we do this surgery, it's, they take more and more, and you're not going to be able to carry children, and this and that. And I said to him, well, I found this stuff called Relive, and it's balanced nutrition, and I really feel that my body can make healthy cells. He thought I had, lost my mind, and so I did opt out of that second surgery. I just really had peace about it. And so it was, I don't know how long it took, but it was less than 6 months when I had gone back, and he told me that I was clear from any abnormal cells. And I never did have that second surgery, so that was wonderful. Another thing, I had a 7-centimeter mass in my left ovary before starting on Relive. And so I had an MRI done for my back, and through the MRI they had found it. So they monitored me. I had a different cancer doctor for that one. They monitored me for 3 months, different tests. Through those 3 months, they were following me very closely. And my doctor said, Michelle, it's time to do surgery. We need to remove this mass because it's just to the point where, they felt it shouldn't stay in there. They did not do a biopsy because if you puncture it, if it is cancer, it's just going to spread everywhere. So they left it all intact. I started on the products. I was on Relive for 1 month, And it was during that time of them saying, you know, you need surgery. And then when I went in for my pre-surgery visit, it's 2 weeks before surgery, the pre-op visit. So I was on the products, and I went in with the ultrasound, and the technician, you know, was doing her thing, and she just said, I'll be back. And I thought, oh, dear, there's something wrong. They're taking me now. They're not waiting 2 weeks. And the door opened, and she came in with all these doctors, nurses, residents. The room was full of people, and I'm thinking, there's something seriously going on here. And so they were all just right, you know, staring at this monitor. And the doctor said, Michelle, I need to talk to you. So everybody left. I got myself together, and I met him in the back. And he said, we can't find anything. You don't need surgery. And I just said, wow, because, you know, a lot of prayer, of course, and I give God the honor and glory for this, but he does use good nutrition. That's what our body needs. And so I never needed that surgery. And my surgery was actually scheduled during the conference that year back in 1994, and I was able to go to my first conference because of that. So that was really neat. So the products have changed my life. One recent thing, when the Lunarich had come out, my cholesterol went down. My good cholesterol went up 4 points, and my bad cholesterol went down 31 points, so that was neat. And I just recently, April 28th, I had a double ligament transplant into my ankle. And that I just recovered extremely well with that. And so I'm pretty much, back 100%. And, I was a little nervous, the Latin ankle there, those two ligaments. And now, people can't even tell that I even had the surgery. So that's pretty
awesome.
neat. Yeah.
Well, so, Michelle, it's a powerful story. You've had some major results, some scary things you faced, and your life has been turned around. Thank you so much for sharing.
Thank you for having me, Bill. Thank you.
Thank you. Okay, well, now we're going to head over to Illinois. I have Jerry Yelbansky with us, and Jerry, we'd love you to share some of what's happened for you.
Okay, can you hear me, Bill?
Yes, Jerry.
Okay. My name is Jerry Jablonski. I'm from Johnsburg, Illinois, and my story, I've been on Relive for 16 years now. Okay. And I started a long time ago. A friend of mine decided to go into business, and she invited me to come over and, see what she was involved in, so I did. And I heard the stories. They all sounded kind of interesting. I basically got on the products just to help her out. To doing it for 3 months, and I thought, well, after that I'll just kind of probably not take it because I really didn't think I needed it. But after being on the products, after about 3 weeks into it, all of a sudden I got some amazing results. Things started happening to my body, and first of all, I got energy. I had hot flashes that went away. My hair started to get thicker. My skin wasn't dry anymore. I had sinus infections at least a couple a year where I was always on an antibiotic, and that was just something that ran in the family. I didn't figure anything would ever go away. Thought it was just an inherited thing. And all the pressure and all the sinus problems just totally cleared up. I had a low back pain from a back injury. I was in the cleaning business and I hurt my back. That went away, and I was just blown away by what happened with my body. I just couldn't believe your body could respond to something. So because of that, I thought, now I see why everybody says they never want to get off these products because that's what I started to say. I thought so I just stayed on them. And, and I figured the longer I'm on them, if all this happened in such a very short period of time, what's it going to be like 7 years from now? Or, so I just stayed on the products. And so, but prior to Relive, I actually had a chemical burn to my lungs. And, being in the cleaning business, I was actually cleaning down a shower that was just solid rust, and I was using different chemicals trying to get this rust off the shower. And finally, I just got toilet bowl cleaner, and I just put it all over there. And all of a sudden, I found I couldn't breathe, and I thought, I just got to get out of this room. Well, what was happening was I was using all these different chemicals, and I didn't know it, but the water was not draining out of the tub. So all these chemicals were mixing, and I started breathing those fumes. So I left the room right away thinking, I'll just get out of here, and I still couldn't breathe. And so I ended up the doctor right away. He put me on some sort of steroid-type inhaler. Can't remember exactly what it was. Gave me some medicine, and he said it'll take a couple weeks for your lungs to heal. He said, but they will heal. But the one thing, he says, when you get older, you'll probably become an asthmatic. And so I thought, well, I'll deal with that then. And he was right. It took 2 weeks for my lungs to clear up. I had a really hard time breathing for quite a while. And so, but they finally did. And then all of a sudden, it wasn't but a year later, I started noticing I felt I was wheezing, and that slowly got worse, and it got worse, and pretty soon, after within the year or 2 years, I was using 3 different inhalers because my lungs continued to get worse. And I thought to myself, just depending on what time of year it was, I just was having such a difficult time with that. And I thought, I'm not even going to be older, and I'm going to be on oxygen at this rate, And so it's just something I figured, another thing I had to deal with. But after being on the Relive products, not thinking anything like that would go away, one day, it was probably about a year and a half, 2 years into it, it hit me, I'm not using my inhalers like I was. And, and as a little time went on, I used them less and less, and I remember thinking, I'm not using them, but maybe I should throw them away. And I thought, no, I'm not going to throw them away. I'm going to need them, And so I hung on to them, and they expired, and I threw them out. And I haven't used inhalers in like 13 years, I think it's been. Wow. And but one of the recent things that happened with me is I've been on. I have a bad thyroid, and I've been on a Synthroid medication for my thyroid for 20 years. And I've heard a lot of people say, that they didn't need their thyroid medicine anymore. And, the doctors always tell you once you go on that, you'll never, you always have to take that. And so I kind of ran out my prescription. I needed to get it renewed, and I thought, and I didn't get it renewed in time. And so I kind of slowly weaned myself off the thyroid medicine. And I've been totally fine. It's been a couple weeks now, and I haven't had any problems whatsoever. And I'm excited to, next time I go see the doctor, or probably in about 3 months, I'll probably get it tested just to make sure things are good. But I could have never done that before. If I ran out of my medicine before, I felt it right away, and I felt sick. And so I think my thyroid has healed, from my body.
That's awesome. Jerry, that's wonderful. Thank you for joining us and sharing.
You're welcome.
Thanks so much. Okay. Wow. Well, we have a couple more stories to go, and let's head over to Utah. And Lori, are you up and at 'em there? See if we can.
A family gathering. I hope you guys couldn't hear the little kids that were gathered around me for a while.
Okay.
Davis and I have had great results with the business and on the products. We've been involved with Relive for 14 years now. It's been an incredible journey. It's been such a blessing in our life. Davis was dealing with a couple of things. He got on the products with diverticulitis. The doctors diagnosed him with diverticulosis, but we know that when he was having flare-ups, it's called diverticulitis. So he had vomiting, diarrhea, and cramping, and those things happen all simultaneously vomiting, diarrhea, and cramping, and you never know when they're going to strike. So he wasn't telling me how worried he was about the future. He wasn't telling me that he was worried that he was going to be able to, that he was going to probably not have a job because of the problems that were happening and ensuing, and just kind of hiding his fears from me. But it really would make him really, really sick. He would usually end up on the floor in a fetal position in the bathroom, or on the bed in a fetal position. And this was a guy that never was sick and never pretended to be sick, never wanted to be sick. He's just a tough guy. And it's a debilitating disease, and it's really scary. And he was going with that for about 10 years before we found Relive. And it was getting to the point that at first it was like once a month, and then it would happen about every other week, and then it was starting to happen once a week. And so we were really happy we found Relive. So we started on the products for that, and then there was another thing that was going on in his life that we had no idea we'd get results with. He was dealing with a shattered kneecap let's see if I can say this right. In 1990, he was at the gym playing basketball. He was at the church playing basketball, and he ran into another kid, and he shattered his kneecap. And he was old, and the kid was young, and so Davis went to a surgeon in the Tucson area, and he said, I want to keep my original parts. I don't want you guys to put any metal in there. So they took two large pieces of the patella that were still hooked to tendon, and they pulled that back together, and they put it in a wire mesh. And it recalcified, but over time it became very osteoarthritic and bone on bone, and just really, really painful, and just had a lot of inflammation in that knee. Off and on he would have gout. Off and on he would have water on the knee. And for 10 years we tried to find answers. We went to hundreds of hours of physical therapy. They would ice it. They would try to put the electrodes on it and try to electrocute it to try to get motion in that knee. They tried everything, and it was to no avail. They couldn't get any motion with the knee, and so over time, all the cartilage was gone. So it was starting to rub and give him a lot of pain. Just before Relive, a team of doctors looked at him and said, Davis said to them, I want to know if I can run again. And the team of doctors were these like world-renowned doctors that worked in Tucson, and they worked on all the big basketball and football stars in the Tucson area. And took him 3.5 months to get an audience with these doctors, and he finally got in. And they checked him, they did all the manipulations, and then did all the x-rays and said, you're never going to be able to run again. You're going to have a knee replacement when you're not 75 years old. At that time, he was about 49 years old. So he got on the Relive products, and immediately the vomiting and the diarrhea and the cramping went away that he was dealing with the diverticulitis, and he didn't expect it to be that fast. My husband's profession at that time was a preventative maintenance engineer for Arizona Electric Power, and he was the biggest in the power plant. He had climbed the engineer pay scale and was one of their best preventative maintenance engineers. And he just knew that it was going to take time probably to fix that knee, but within just a couple weeks on the products, he was not having any of the symptoms of the vomiting and diarrhea and cramping, and he was so excited. And all those symptoms just go away unless he doesn't take his shakes. And there's been a couple of times when he's gotten really, really busy where he has just not taken the shakes, so, hasn't been real careful about taking them like he should. And one time he got really sick, and he headed back to the hospital with those symptoms. So we know that Relive doesn't cure anything, but it sure does keep all those symptoms at bay, which has been a real blessing. Now, as to the knee, I would say that at the 1 month mark, about 1 month on the products, he was taking, the very beginning he was taking the basics, and then at the 1 month mark he was taking the fiber, and then at the 8-week mark he added the anti-inflammatory, which is the Arthifect, and he just was doing really, really super. All of a sudden, about the 10-week mark, we were up in Colorado. We were going to a wedding, and we were walking while we were there for a few days, and we were walking up and down hills, and he wasn't having any inflammation, but the biggest thing I noticed first was that he wasn't having any pain. And I looked at him and I said, what's going on with you? You're not limping anymore. Excuse me, I didn't notice that he wasn't having pain. I noticed that he wasn't limping. Sorry. And he said to me that the pain was gone, and I was like, what? And that was the first time in 10 years, and we were so delighted and so happy. So happy that he was doing so well. And we were just inexpressible joy because we'd been looking for results with that kneecap forever, and he just started to get better and better. And pretty soon he was able to run. He ran a quarter of a mile. At about the 11-week mark on Relive, he ran a quarter of a mile, and he waited one full day, and there was absolutely no inflammation. And that was just unbelievable. And he ran a little bit further a couple weeks later, and he ran a little bit further after that to where he's made it up to now he's running 5 miles a day. Now, people would come to our meetings, our Relive meetings, and say, did the cartilage come back? Well, guess what? You can't see cartilage. But he went on a business trip to Boston, and he broke his finger. He came home and went to the doctor, and the doctor did x-rays on his finger and did his finger x-rays on his knee. And he said, you can't see cartilage, but you can see space. And we know that the cartilage came back in that knee because there's space there. Well, we already knew the cartilage had come back because he was running. But people always want to know the evidence and all that kind of stuff. And so we were really excited for what Relive had done for us. I've gotten results with neck pain, my neck pain on a scale of 1 to 10, and the pain threshold was about a 20. I just was out of control. I didn't know what to do for it. I had tried everything. I'd been going to my doctor, and he was no help to me. So anyway, I was just really happy to find Relive because I got on the products, and within about 2 months, my neck pain was gone. My hay fever allergies that I dealt with forever and ever were gone. They had plagued me for 20 years when I was a young mother in Arizona. I just always seemed like I never had any energy. I could never get through the day. Truly, I just felt like I just was never going to have energy. Excuse me. And I got on the products, and I had about 3 hours of extended energy. That was a good energy. It wasn't like a high or a buzz. It was just really wonderful, prolonged energy throughout the day. And I'm a grandma now, and I can take care of my grandkids and do things, and I try to walk about 5 miles a day, and I just have excellent health. Excuse me, I just swallowed one.
Her coughing in here. She couldn't
Let me see if I can mute the lines. We've got some background noise. Hold on,
yeah,
let me check that.
I hear the background.
Okay, go ahead.
Anyway, with the business part of it, I had been a school teacher, and I was working really long hours, and I was really frustrated, and I think it caused a lot of my neck pain. And I did the math with what I was earning as a school teacher. I had just finished my degree a little bit before Relive. I'd been a teacher for about 6 years. I still hadn't paid off all my student loans. And I figured out the math for all the time that I was working as a school teacher and all the effort I was putting in. And people think teaching was such an easy profession, but I was teaching 6th grade, and I had 32 students in my classroom, and I had 6 hours of that day that I was teaching all different subjects. A lot of preparation. I was working about 11 hours a day, and I figured I was earning about $1 an hour for my work. That was year-long work, and so that wasn't very great pay, but I sure loved being a school teacher. But I got into Relive, and the very first month I earned $3,200, and the second month I earned $10,000. We earned $10,000. The third month we earned $10,000, and the fourth month we earned $12,000 with Relive. Our first full year was 2002. Right after the economy kind of dropped, and we earned about we earned about $90,000 our first year, and our second year we earned about $140,000. I've been able to kind of semi-retire with Relive. I wanted to be a grandma and do that exclusively for a little while, and then really enjoy my grandkids while they're little, because I'm not going to have very many grandkids gathered around me. And so we've been averaging anywhere from $70,000 to $100,000 a year. And it's just been a real blessing in our life, and we'll be so ever grateful for Relive. We've earned about 50 trips with Relive, and some amazing trips that I'll never, ever forget, and just had some miracle trips in our lives, too, with Relive. And I just love the company and love the corporate part of Relive, and have just enjoyed our journey with the company.
Absolutely. It's a company with a heart.
It is.
Wow, what an honor and a privilege to be involved with a company that's making a difference in people's lives, as we've heard these stories tonight. And so the business is a win-win. You help people and you get blessed at the same time.
Well, you think about it, I'm semi-retired and I still get a paycheck. It's pretty incredible.
and a pretty serious one at that. Well, I'm running late on our call. I got one more story to go. Lori, I want to thank you so much for sharing.
Oh, you're so welcome.
Tonight.
Thank you, Bill.
Thank you. Well, guys, it's my pleasure. I have one more story for you tonight, and you're going to be certainly glad you hear Scott Decker and he and his wife, Dot, have had some wonderful results. Guys, we'd love you to share for us.
Okay.
Can you hear me, Bill?
I can. Go right ahead.
This is Dorothy Decker from Wichita, Kansas. And when I started on a Relive, I was basically pretty healthy. I was taking different kinds of vitamin pills, like a lot of people do. But I was still having problems with knee pain climbing stairs. And I also was having like 2 or 3 colds a year. And after I started the Relive products, I have no problems with the knee pain. I have less colds. If I do have a cold, it gets over quick, or it's not, not anything like what I had before. But in about 2011, I found out that I had breast cancer. And, you kind of wonder what to do, and you think about it. And I decided to opt for the surgery, but I gave myself some time to build up my immune system so that I could do well with the surgery. I did the surgery in December 2011, had a good surgery, had a good recovery, no major problems. I did not take chemo or radiation with that. I only took the Relive products, and I'm still taking the Relive products, and that's it. And just feeling really good and having good blood work and everything. So that's basically what I'm talking about tonight.
That's wonderful.
Thank you.
Thank you.
Can you hear me, Bill?
Yes, Scott. Go right ahead.
Okay. Hello, everyone. I'm Scott Decker from Wichita, Kansas, and I'm grateful that somebody cared enough about my wife and I to introduce us to Relive, and that's been about 11 years ago. At that time, I had carpal tunnel in both of my hands for over 18 years and wore cox plants for over 20, and never did have the surgeries done, and today I have no problems with it. I had my left knee scheduled for replacement, and it was due to arthritis issues and no cartilage left. And after I was on the products for 2 weeks, I called and canceled that appointment because that knee felt so much different than it had felt before. I started on those products, and I'm still walking on it today and don't have a bit of trouble with it. And I do have osteoarthritis throughout my body. I had fingers that absolutely didn't work, toes that wouldn't bend. I couldn't do anything with them. I had bone spurs on the bottoms of my feet, on my fingers, and other places on my body. And I was just going downhill very rapidly. And my doctor did give me Vioxx for my arthritis. The end result of giving me that Vioxx was that it damaged my heart. It did not help my arthritis at all. I still had all that arthritis pain. And the biggest thing that happened and the worst mistake I ever made was taking that Vioxx, because when I took it and with the heart damage, the prognosis from the doctors, when I had my regular doctor and 4 cardiologists sitting in his office, not the exam room, but in his main office, and they told me that by the time I was 65, the way that heart damage was going, that I'd probably have to have a heart transplant. That was a day that I sat there in shock. And shortly after that diagnosis was when Relive came into our lives. I did not have to have that heart transplant. I'm 72 years old now, and I'm grateful that I do have the quality of life. And as bad as my health used to be, I don't want to go back there ever again. And I will continue to use the Relive products. I will continue to share them with everybody that we can. And the young lady we had on here with the guest firms with us tonight, she has never heard of Relive, and she was amazed at what can transpire. So we'll just continue with helping the next person we can find, and with literally all over the world, and make friendships everywhere.
There you go. Well, you're only sharing the tip of the iceberg, Scott. I mean, you've had a lot of different results. Let me just ask you to share a couple of the other parts of your story. You had some results with some prostate issues.
Yes, I had when I had a prostate exam and they did all those samples up there, they found precancerous cells on the very first one. They sent me to all the different places and doing all the different tests, and I opted with the American Cancer Society to do that selenium test for 5 years and go through those biopsies every 4 months. And after I started with all of that. We started on Relive. I quit having all those biopsies done, and I had a roto reader done, and the doctor that did the roto reader on there so I could get my prostate shrunk back down toward its normal size found dead cancer cells in the biopsies that they took out. And I'm
so after being on Relive, they found dead cancer cells.
Yes.
Wow.
Yeah. So I'm grateful that they did. And I've had issues with my eyes. I've been legally blind since I was 3 years old, and my left eye when a horse kicked me in the side of the head. And my vision in that eye right now is uncorrected is 20/90 when I'm looking at an eye chart instead of a spot on the wall.
That's awesome. Wow. Well, Scott, you and Dorothy have had some wonderful things happen for you, powerful results, and we so appreciate you joining us and sharing tonight.
Well, we're glad we're here.
Thank you.
And you all have a wonderful